there's a lot we still don't know about this virus.
The only way to stop it is to kill it. The Chinese, they believe the government lied to them. They believe that they knew about this. It was going on for 2 months before they did anything. There's a lot of anger.
It became a crisis. It was just out of control.
Italy waited too long. South Korea responded immediately.
20% unemployment may be a small number compared to where it could be 6 months from now.
We don't want the airlines to go bankrupt. The consequence would be catastrophic.
But you're still saying 18 months.
I think that's extremely aggressive because of the phases.
It is extremely aggressive? Or
It
it's
is.
Not?
It is.
Even 12 to 18 months
Yes.
is. How long can we really sustain this?
Younger people are going to the bars. They're the most dangerous because they don't even know they're ill.
How bad can this thing get?
Right now, the death rate in the United States is 2%. That's a lot of people.
So we have the solution right now with a drug to fix it.
What if it has a side effect no one anticipated?
Why don't we do social distancing for those above 50, but below 50, let them go to work?
They go back home, they're infected, and they kill their parents and grandparents? Is that what you're telling me? Let's kill all the capitalists off. We want all the CEOs, the vice presidents,
saying that.
middle management. No, I'm not saying you're saying
I'm
it.
saying if you're my CEO, I'd say, dude, go home.
We're getting to the bad.
This is the bad. 80% of our drugs are dependent on China. This is a national security issue.
That's very concerning for the average person.
This is a real problem. It's a crisis. It is not the apocalypse.
Tell the media that.
Did you ever think you would make it? I feel I'm so close I could taste sweet victory. I know this life meant for me. Yeah, why would you bet on Goliath when we got Bet David? Valuetainment, giving values contagious. This world of entrepreneurs, we get no value to haters. How they run, homie, look what I become. I'm the one.
So look, with the recent videos we've been doing on coronavirus, many of you guys were asking about if I can bring a couple experts here to talk about this pandemic. So today, I have with me two guests. One is Professor Andrew Natsios, who was a former lieutenant colonel for 23 years. And I also have with me Dr. Parker, who was a former colonel in the military. They both are experts on the topic of pandemic. And I'll let them introduce themselves to you on what they do professionally and many different experiences they have. But I got a list of questions to go with them. So having said that, let's get right into it. Gentlemen, thanks for coming out.
Thank you.
Thank you.
So if you don't mind taking a moment and just kind of introducing yourself, what you do, we'll take the lead from there. You can
So
go
I'm
first.
a professor in the international program at the Bush School of Government at Texas A&M, and I run the Scowcroft Institute of International Affairs. General Scowcroft was the national security advisor to President Bush 41, the older Bush who just died a couple of years ago. So 12 years I've taught. I used to teach at Georgetown University in the Walsh School. But for much of my career, my later career, I was in international development. So what do you do to help poor people in the developing world? In agriculture and health. So I was the administrator of the United States Agency for International Development, which is the foreign aid program of the U.S. government that helps poor countries. And we've been doing that since 1961. President Kennedy created it. President Bush was one of our great heroes because he tripled the budget for foreign aid. Most people don't know that. And his program on malaria has cut malaria rates in Africa 50% in many countries. And the HIV/AIDS program he started has also pushed back the HIV/AIDS problem in Africa and other areas of the world. So I did that. I was with World Vision, the NGO, for 5 years in the 1990s as a vice president. So I have an academic career. I have a career as a aid administrator, and then I have a career in state government in Massachusetts, where I originally come from. I was in the state legislature for 12 years, and then I was chief operating officer for the state, and then I ran the Big Dig, which is a huge construction project in Boston. After there were cost overrun scandal, I had to fire a bunch of people, and it was a kind of a big mess. So I have 3 careers.
And you also work with Dr. Fauci on HIV.
Well, I worked with him 15 years ago because he's the one that convinced President Bush to start the program. And we worked with him, and the global health program at AID is its strongest sector that AID works on. It has projects all over the world. And one of the things we should have been doing is mobilizing AID to help people in Africa, Latin America, the Middle East, and Asia in poor countries to deal with this because they don't have a lot of support. Without AID and without some of the other aid agencies, the UN is overcommitted right now. It's just WHO and the World Health Organization, and they need help. So they've begun to mobilize. Congress put $1.5 billion in the budget that just went through the president's sign to do this. So I'm happy, but I think they should have done it 2 months ago.
Well, we got to get into that.
Sure.
And I got a list of things I want to get into. How about yourself, Dr. Park?
So I would describe my career as public service, public health, national security. Now I'm the director of the Pandemic and Biosecurity Policy Program in the Scowcroft Institute, and I'm also an associate dean for Global One Health at Texas A&M. Prior to joining Texas A&M about 6 years ago, I had 36 years at the federal level, 26 years in the Army, active Army, and a lot of my career was spent at the U.S. Army Medical Research Institute of Infectious Diseases. I was a former deputy commander and commander, affectionately called USAMRID. Many people know it as that. And so I kind of cut my teeth on biodefense, high consequence emerging infectious diseases from that experience. When I left the Army, I went to the Department of Homeland Security, and then I was drafted and pulled quickly over to the Department of Health and Human Services in 2005, about 30 days before Hurricane Katrina hit. And so I kind of quickly pivoted to emerging infectious diseases, to things like healthcare capacity and things like that we're also dealing with today, and then pandemic preparedness and so forth. So I was a principal deputy assistant secretary at HHS for that's one of the leading forces right now for the Department of Health and Human Services. And my last tour in government service was at the Pentagon as a Deputy Assistant Secretary for Chemical and Biological Defense. And my career kind of crosses over, like what Andrew said, with Tony Fauci, and certainly when I was in HHS and DOD, but it goes back to the anthrax letter attacks in 2001.
So it's fair to say you're both qualified to talk on this topic, which is why we have you here. So we're excited for you to come out and spend some time with us. By the way, I posted a question yesterday. What questions would you ask them? And we got lists of questions. First person I asked was my 8-year-old son. What question do you have about this pandemic? I said, Dr. Parker is going to be here. So do you have any questions for him? I said, is he related to Peter Parker? So for full transparency, any relation to Peter Parker, we can get that out there so he knows.
No relation that I am.
So Tico, just so you know, there is no relation. I know it was important to know that. So let's get right into it. So good, bad, ugly. A lot of people are afraid. I'm in the business world, I'm in the financial world, and we're creating content, and we have employees, agents, clients, everybody. There's a lot of people that are afraid because there's this level of uncertainty of people still don't know what's really taking place. From where you're at and what you know, what good do you know about what's going on right now, progress, bad and ugly? So good, bad, ugly. You can start off with ugly or bad first, and then go to good if you want to. But you can. You
want me to start?
Yeah,
I'll take a start. Yeah. Well, I think actually one of the good, because we pivoted from a period of what was called containment strategy, when the president actually imposed some travel restrictions from China, and at that time that made a lot of sense, and we took a lot of actions to begin to try to contain the virus when we go back to end of January timeframe, and that was essentially to buy us some time to start doing some preparedness. And so the organizations are going to be best prepared are the ones that took time to start preparing back when the containment strategy really began. But we've clearly hit an inflection point where we clearly have transitioned to a mitigation strategy plus containment. But and that mitigation strategy is really reliant on what's commonly talked about now, is flattening the curve through social distancing, social separation interventions, both personal and at the community level. So what I would say is good about that people are taking it seriously. And they are moving out actually with some government guidance at all levels, federal, state, local. But universities, businesses, schools are taking action, and people are paying attention to it. And they're not necessarily waiting for the federal government, to tell them to do something. The guidance helps, but I would say that's part of the good, that the seriousness we are taking in the social distancing interventions. Now, we have a long way to go, and I know that's now having a huge impact on our economy. But we know that, and I would say also that is the good as well. So we are getting good guidance, or we're getting guidance from the federal, state, and local level on what it means to protect our public health. But we're also seeing a lot of action to try to address some of the economic impacts as well. And so we'll go into some of the bad later.
So that's the good.
That's the
Any
good.
good you have?
Well, I think there are basically three ways of combating a pandemic. One way is a vaccine. We don't have a vaccine. It'll be a year and a half before we do. We can't wait that long. I mean, the consequence would be catastrophic. The second is through medication that will kill, by taking a pill, you kill the virus, called antiretrovirals. We call them antibiotics for a bacterial infection, antiretrovirals for a viral infection. This is a virus. We have a bunch of antiretrovirals that already exist, but they don't know what it'll do to this virus. It could make things worse, conceivably. Not likely, but conceivably. We don't know which one works better than the others. So they're testing them now, and Jerry tells me 2 to 6 months before.
Yeah, there's some promising antivirals that are already approved, FDA approved for other indications, and the preliminary evidence that suggests that some of these antivirals may have efficacy against the COVID SARS-CoV-2 virus. And so clinical trials have already begun to look specifically at this virus and whether they would help clinically.
So the social distancing is not going to solve the problem, because as soon as you stop doing the social, if you get the infection rate will go down if everybody follows the instructions to do the social distancing and quarantine and all that. So, but then when you stop doing it, it'll go up again. The only way to stop it is to kill it, and you can kill it through medication and later vaccines to prevent you from getting sick at all. But that's not, these are
18
sequential
months.
in terms of timing. So the amount of damage to the economy and the number of people who would die if we waited for the vaccine that's not an option. But we have to do it because the permanent long-term fix is massive inoculations around the world and a vaccine. So we're doing the right thing now with limited resources and limited tools. Now, let me mention who is at risk, because the data is very, very interesting that's coming out, and there's more and more data. We had a lot of data from China, and there was a large study done that was published in the American Medical Association
Journal, yes.
Journal of American Medical Association by Chinese scientists. We think, our scientists believe that it was legitimately done. A lot of the data, I don't believe the data coming out of China. I think it's cooked because the Chinese government's an autocratic regime, and they're using this crisis to advance their strategic interests that have nothing to do with they're using the crisis to push us aside and say, we are the ones that should be leading the world, not the United States. Well, we can talk about that later. But we have data now out of Italy. And Italy and South Korea are democratic systems. Their scientists are not going to be ordered what to do. They wouldn't follow it anyway. But a study came out yesterday from the very large caseload in Italy, which is now the second largest in the world, is it not? Next to China. And I think there are 27,000 people infected, and they've lost a large number of people. Large number. It's the highest death rate in the world. 8% of the people who get sick die. South Korea, who was way ahead of everyone else, has only 1% death rate. Now those figures are going to change. They both have modern healthcare systems. Italy waited too long to respond. South Korea responded immediately. South Korea tested everyone, massive testing, 250,000 tests. That allowed them to target what they were doing. And the reason they did all this is they had a SARS, another virus similar to this one, that took place 15 years ago. They screwed it up then, and they fixed it. The Koreans fixed their system.
Were prepared from a past
That's
mistake.
exactly correct.
That's very good news.
Yes, preparedness does work if you do it at the senior level with all the ministries, in the case of South Korea, our departments in our case. So now, who is at risk? The study says, in the one that just came out, 99% of the people who've died in Italy had some other comorbidity, which means some other disease. They had cancer, they had a heart attack, they had a stroke, they had diabetes, they have an autoimmune disorder.
You said 90%?
99%.
99%.
99%.
Okay.
That's what the study says.
Got it.
Okay, now, the one that people have not talked about at all, I mean, it's in the data, and there's a study in China and one that I saw that is exactly the same, but not the same percentages, that was done in Wuhan in a small sample. The group that is most at risk are people who have hypertension, which means high blood pressure. Now, we looked up the data this morning. According to the Center for Disease Control, the preeminent group of scientists in the United States and the federal government, 108 million Americans, 30% of the population, have high blood pressure. Okay? 30 million should be on medication, and they're not. And 75% of these people should be trying to control their high blood pressure by minimizing, for example, the amount of salt they use, exercising more, not eating fried foods, for example. I mean, you can lower your blood pressure without medication, but they're not doing that. Obesity causes high blood pressure. That contributes to it a lot. So 75% of the people who died in Italy had high blood pressure that was not being treated. Okay? So Jerry gave me an explanation. You don't want to go, I didn't even understand what he was talking about, as to why there may be a biological connection between this virus and high blood pressure and why that is killing people. So the advice is get your blood pressure tested. If you have high blood pressure, you should be on medication. Maybe it's too late in your life to do it, because if you don't take the medication, you're likely to have a stroke or a heart attack with high blood pressure if it's not treated properly. Exercise more. If you improve your lung capacity, that'll also make your lungs stronger, because the other element of this is the younger people have very low rates. They have the same rate of infection, but they have very low rates of mortality, under 40. Very low. In the case of Italy, most of the people who died were over 60 years old. Huge percentage were over 60 years old. That doesn't mean younger people can't get sick. It means they won't die from it. Now, there is some evidence that it can also damage your lungs. If you get it, but you survive, 20 to 30% reduction in your lung capacity. How accurate is that, by the way? It's a preliminary report. All of this is preliminary.
I think we all have to be cautioned to not focus on any given statistic or any given literature publication in a moment. There's a lot we still don't know about this virus, and we have to just understand that and appreciate it. But every day we are learning so much more about this virus. And the scientific knowledge about this virus is extremely important to how we guide our public health response. And we just have to accept that right now we are still in a data gathering mode. It's very similar to other outbreaks that we've experienced, including the 2009 H1N1 pandemic. We are in somewhat of a fog of war, unfortunately, but that happens with all kind of serious outbreaks. This happens to be a really serious outbreak and a potentially real serious virus that we have to pay attention to. We don't have to worry. I mean, worrying can be counterproductive. We have to be concerned about it. I'd like to go back. Could I go back and visit the community mitigation?
Sure.
A little bit too,
and sure.
to maybe show some examples of why it's important at a macro level.
And by the way, just out of curiosity, are we still on good, or have we gone to bad, or have we not gone to ugly yet?
We're still on
good. Okay,
yeah,
so we're going to get
well,
to
the
bad.
stuff I was bringing up is
you brought some bad stuff.
There's some bad stuff.
He
Got some bad stuff. Bad.
So let's see where you're going to go.
I'm going to go back to the good again, and why community mitigation is important, and why flattening the curve is a real phenomenon. And we can just look at the macro level and without getting into statistics, but look at China and the impact of COVID in China. And so where there were some draconian social distancing measures put in place around Wuhan and then the entire Hubei province, which included up to 60 million people, that was a complete shutdown with a lot of police control and invasion of privacy and et cetera, et cetera. So when you look at that, and it became a crisis. It was just out of control. But when you look at the data from the rest of China, actually that lockdown of the Hubei province actually mitigated the severity of the disease in the rest of China. And so that's just an example on a macro level that these actually community mitigation, now that's draconian, we're never going to do something like that in our country, and most countries would not do that. But then there's some other good examples. And so you look at Singapore, you look at Taiwan, they have largely mitigated the severe impacts. They have a lot of cases, but they've been able to mitigate some of the severe impacts and the overwhelm of the hospital systems and so forth, and mitigated the number of deaths. But it was social distancing, essentially, the community mitigation, social distancing, and containment and laboratory testing. Compare that to Italy, where Professor Natsios has already said they waited way too late to implement any community mitigation, and we see the results compared to Italy versus Taiwan, Singapore, and then in South Korea, somewhere kind of in the middle. But they jumped out at it too. They had kind of a unique case with the Diamond Princess cruise ship that was part of what started there. Or no, that was Japan. I'm sorry, I got that mixed up. That was Japan, but Japan got a lot of elevated cases too. But South Korea had to do with the church in Daegu. But what really helped South Korea, as Professor Nazio said, with the extensive laboratory testing, so they can identify where there were hot spots in their communities and do something about it and more aggressive in the community mitigation measures. And so, but those are just at the macro level, can give you an example of countries that have done well versus those that have not.
So, Doc, you said that China took the approach of a draconian?
It was extremely draconian.
So, can you elaborate what you mean by that for somebody that doesn't know what you mean by that?
Well, I would just say it was essentially a complete shutdown and forced quarantine of a population of 60 million people. And people were not allowed to leave their house. There was enhanced surveillance. Police powers, information was not flowing, and so that was, I guess I would call the draconian, just something that only an authoritative government like China could do.
They put paper on people's homes with tape, and if you break the tape and go outside, the police would come. So you could not leave your house, or you get into trouble with the police.
So what do you think about the threat that's going around saying we may possibly be put on a shutdown? So if you're saying that there's no way in America we're going to be put on shutdown, because I've lived in Iran before where we were on curfew or shutdown, you couldn't even leave the place, and it was a law where the government's going around looking at you to see what you're doing, right? You're saying that's not possible in the U.S.?
Well,
not like it was happening.
Not with the paper. I'm talking about National Guard coming out.
Not with a National Guard coming to arrest us and police powers.
It's not a police state.
We're not a police state.
Okay.
And now, can we take some aggressive social separation measures without having all the kind of authoritarian type regime? Of course we can.
How aggressive?
Well, we are doing things like now. Universities are moving to distance learning and taking social distancing measures. Some industries and businesses are maximizing work from home policies. There are areas where schools are closing down. In fact, I think I heard this morning that one state, Kansas, the governor decreed that schools should close for the remainder of the spring. And so yes,
all of our classes we're going to do by
do by distance learning.
Are you choosing to do that, or are you being forced? You're ordered to do that,
and we can't travel abroad. There's no travel abroad.
And who is ordering you?
The provost of the university.
Okay, got it.
She's our ultimate boss.
But is anybody forcing her?
No, I don't think so.
No. These are just prudent measures under the circumstances with a public health threat that globally is very high. In individual communities in the United States, you'll see some people will say in individual communities the risk may be low, but in some communities the risk is already high. And so we're going to have individual communities across the United States are going to be impacted at various different times. This is not going to just hit the United States all at once. It's going to hit individual communities at separate times. And so people are just taking some prudent decisions, trying to keep the students, the faculty, in this case the students and faculty, safe, and mitigate the loss of life, but also continue with the mission of education. And so, that to me is not a draconian measure. It's a very prudent, safe, sound measure to continue, in this case, our education mission, keep our students safe.
I read an article yesterday from Goldman Sachs that was on Forbes, I believe, that said on a call with 1,500 investors, they projected that, 50% of America is going to get coronavirus. About 150 million people are going to get coronavirus. That's the data they gave. And 3 million people are going to die because of it. Now, there's this article you're reading. You've seen the number being thrown around by other places, not just them saying it.
Some of them are exaggerated.
Right, some of them it's exaggerated. Now, there's the flip side is, you heard about China slowing it down, and they're no longer getting the kind of surge that they were getting. But then you came back and you're saying the fact that happened because they fully shut everything down. So social distancing worked, but if you let them loose, because some of my friends said, I did a conference call at 1:30 today saying people who were buying products and they were doing their businesses based on buying the products from China, those factories are now opening up and you can order from them again. So now business is back to usual. for some places, not everywhere. So the cases are not growing as bad as they are. So if the cases were able to be controlled in China, and we're projecting that we may go to 150 million if we don't take care of it, if you look at those numbers, how long can we really sustain this if we go out to space? If we go social distances, you're talking 18 months of vaccine.
They're using models to project this, and they're very thoughtful people and they're sincere people. But Bob Cadillac, who was Jerry's predecessor, actually we gave him a career award at our annual pandemic summit. We've been having pandemic summits for 5 years. By the way, our white papers are available on the Bush School website. We've been predicting this would happen, not with the coronavirus.
Put all the links below, by the way.
Yes.
Put all the links below.
Okay. So we've been saying this would happen. We proposed a bunch of things that we thought should happen to prepare the country. And when the president signed the executive order in 2018 on pandemics, which was required by statute, they took language out of our white papers and put it in the executive order. So they know we were reading it. We passed it up to Congress, both parties. And they followed some things, they ignored some things. The hard things they ignored. That's what usually happens. But the point here is that once the Chinese put people back in the factories again, it's likely that the infection rate is going to go back up again. Not as like it was before, but it could go back up again. And that we're seeing that a little bit in Singapore, a little bit. So we don't know what's going to happen. But there's some people privately, they're saying this, that the social distancing works as long as you keep doing it, but then you can't do it forever. Now, so the question is how long this is going to last, and we don't know that. We don't know that.
We don't know that, but I think we can take some lessons. What we're seeing in China.
Right.
They were locked down, and the cases now are they're on the downslope of that epi curve, and that was about 2 months. And so that's what you're seeing too with Dr. Fauci, who's really our preeminent person in the United States. He is talking about an estimate, and he really admits we don't know for sure, but that's the estimate that he's been using. That this may be 2 months to get on the real downslope of this epi curve.
I was going to quote Bob Cadillac, Jerry's successor, not predecessor.
He's a colleague friend.
But he said that the models don't work. And the models that were predicting these 3 million people. But even if you take a much more conservative view, right now the death rate in the United States is 2%. So it's not 1% like Korea, it's not 8% like Italy, it's 2%. Let's say it's going to be 1%, because Fauci, when he was testifying before Congress, he used 1%. That's a conservative estimate. That's still 10 times higher than the death rate for the flu. The flu is 1/10 of 1%. So it's a conservative estimate. And if you say 20% of the people are going to get infected, that's 66 million people. Say 1% of 66 million is 1.8 million people. That's a lot of people.
And some communities will be hit harder than others. I would come back just to make sure I got the quote on the models right, because and it's essentially because models can be very valuable as well.
Yes, they are.
Because there are a lot of assumptions. Models are as good as assumptions that go into it. So going back to what I said, there's still a lot that we don't know, and so we're having to put assumptions of what we can estimate. But at the end of the day, just like hurricanes, when we see a hurricane come out in the Atlantic, how many different model projections are there? A whole bunch of them. As a hurricane gets closer to us, then the models start to converge a little bit. So it's kind of analogous to that. So, when we're seeing a hurricane way out in the Atlantic Ocean, all models actually are very confusing. But as it gets closer, those models begin to curve, and then they become more helpful.
How bad can this thing get? How ugly?
Well, let me kind of go back to some of the statistics too, and why we need to be really concerned and careful. Yeah. We've heard a lot up until kind of recently. The good news is what looks like only 80%, 81% of the people it's mild, and that is the good news. But the unfortunate news, it's 20% or not. And so, actually going back to the biggest cohort again from the Journal of American Medical Association, which was published by China scientists, but has been through pretty thorough peer review. 15% of those are severe, and many of those require some level of hospitalization. But some of those in that 15% category slide into the critical care. And that critical care is requiring intensive care, ventilator support, and so forth. So it's really that 5% number that we should be concerned about. And those, the more that we can keep those in that severe category from sliding into the critical category, because once you slide into that critical category, that's almost a 50% mortality. And it's not just a disease of elderly, although those over 60 are one of the vulnerable populations, but anybody that has one of these other comorbidities. And so going back up to the macro level, in the United States, there's about 105 million people that kind of fall into this vulnerable population category. 70% of that 105 million people are actually in the over 65, but 30% of them fall in this 18 to 59-year-old category that happen to have a comorbidity or underlying health condition.
So there is a report, we're getting them anecdotally, but there was articles in this happening in Europe in the newspapers, that younger people below 30 are just ignoring this. Maybe they read the data that, by the way, there's no child under the age of 9 who's died. So children can get it, and they show symptoms, but it's not severe and they don't die, thank heaven. We don't understand why that is. So the research eventually will tell us why. But younger people are going to the bars. I heard reports of comorbidity parties with a lot of kids getting together. Now, that's irresponsible to do that, but they should think about their parents and their grandparents, because if they get sick, they can get members of their family who are older, who are over 60, sick. And you wouldn't want to be responsible for your grandparents or your parents dying. I'm sure they're not even thinking of that. They say, well, I'm invulnerable. I can't die from this because I'm young and healthy and all that. Well, they can get other people sick. They can get the professors sick, which Jerry and I worry about a little bit.
They could be an asymptomatic carrier.
Exactly. That's right. That's the other thing. People can carry the disease and have no symptoms and not be sick at all. They're the most dangerous because they don't even know they're ill. And there is some evidence, not substantial evidence yet, that there is asymptomatic carriers.
Yes, there is.
There is.
Yeah, whether it's a question of whether it's a major driver of the transmission, probably not, but it can happen.
Right.
Interesting. So, are you hearing about what UK is doing with the herd immunity? What are your thoughts on that? Because, somebody asked a question, they said, well, Pat, if we know the cases below 50, the death rate is below 1%, and cases above 50 is higher, why don't we do social distancing for those above 50? But below 50, let them go to work because they're not really being affected. Why?
So when they come back home and their parents are living with them, and they're not going to die, the ones under 50. They go back home, they're infected, and they kill their parents and grandparents? Is that what you're telling me? That doesn't make any sense.
The UK is doing that.
It's not a good idea. It's a terrible idea.
I hope we don't do it in the United States.
So how familiar are you with what they're doing?
Let me go back to models, because this is actually where I think models has converged over the years, just on the application of non-pharmaceutical interventions, social distancing. And so the models have pretty much been in agreement over the years, particularly as we studied pandemic influenza, the threat of pandemic influenza, starting back in the 2006, 2007 timeframe, and then applied in the 2009 pandemic. The community mitigation or non-pharmaceutical interventions, you have to be pretty aggressive. You can't just pick one demographic, not another demographic. You have to make sure that you're doing things for industry, universities, other non-government. You just can't piecemeal a community mitigation measure, because the models tell you that's not effective. And that's essentially what you described from the UK would be kind of a piecemeal approach to community mitigation, trying to socially separate one demographic versus the others, when in reality you just can't do that. And be analogous at the end of, we can come back to borders in a minute and how borders and border closures, what effect they may have, on stopping, ultimately stopping something, but we can come to that. But it'd be some, because at the end of the day, viruses don't respect and know borders and boundaries.
So UK herd immunity is, if you don't mind just explaining
Sure.
what herd immunity is.
Well, that's when you have enough people in the population that have an immunity to a given virus, that there's immunity and the transmission from the virus is going to ultimately die out. And that measles is a good example, that we know measles is very infective. And you have to have over 95% of the population needs to be immune, which means that's you have to have a herd immunity in the population of over 95% to really kind of stop transmission and not have disease. If our herd immunity drops below 95%, we will see transmission of measles. COVID-19, we're not sure what it is yet, but some of the early studies say it's probably in the 60, 65%. We don't know for sure. I'm just, but that's a statistic I'll throw out. And so I don't think what the measures UK are going to do are going to provide enough herd immunity to stop transmission.
So they want 70% of the population to get it so their immune system can fight against it, and then they go back to business as usual. So let me go back to what I was asking.
Well, let me tell you the other problem with that. Herd immunity, by getting the disease, does not always guarantee you won't get it again.
Right.
And we don't have enough scientific research at this point to conclude that getting most diseases, if you get one, you build up antibodies, and if you get the disease 10 years later, your antibodies will kill it. But we don't know that, because some viruses, that is not the case. And so they're making some assumptions that are, in my view, they're very dangerous
Very
assumptions.
dangerous.
Very dangerous assumptions.
The assumptions they're making is very dangerous.
Yes.
So let me ask you the flip side on this. So you're saying, are you willing to go to work and get the virus and bring you back, and God forbid somebody that's about 50 in your family that lives with you ends up getting the virus, right? That's what you said. Okay. So the flip side to that is, if you're saying we cannot get a vaccine for 18 months, I know they did the testing on a vaccine in Washington, and I think they did 45 of them a couple of days ago. They keep testing it, and they're saying it's a record-breaking time. You heard what President Trump just said a couple hours ago, that fastest record-breaking time on the progress they're making, et cetera, et cetera. But you're still saying 18 months.
For a vaccine? For a vaccine?
And
Sure, yeah,
expert
absolutely. And so the it is record-breaking progress that we're making in vaccine development. And we're able to use new tools that are essentially allowing us to design new vaccine candidates. The operative word here is candidate. Based
that
on
means options.
Based on the genetic sequence. So the operative word candidate, that means it's still in the experimental phase. And so the good news is, at least, there's at least what I've seen in the data, there's at least 20 companies, universities, or 20 vaccine candidates in development from private sector or universities. So that's 20 vaccine candidates going in some phase of very early discovery development and beginning to go into from preclinical to clinical phase 1 studies. Phase 1 study is just the first clinical study. There's a phase 2 study that follows a phase 1 study. There's a phase 3 study that follows a phase 2 study. And the phase 1 is only looking at safety. Is there any untoward safety observations in a very small study of humans? Phase 2 is a larger cohort, maybe 200, maybe 200 to 500 people, and the vaccine candidate is produced at a little bit larger scale under good manufacturing quality control standards. And it also looks at safety, but it begins to look at, does the vaccine produce an effective immune response? It's not tested in against the virus in a hotspot. Phase 3 is then when you begin to use a more commercially scalable type manufacturing process for that vaccine candidate that's still in experimental stage, and put it in a larger population to really look at clinical efficacy in a hotspot and to see whether the vaccine is working against the virus. Those stages and that manufacturing, advanced development, manufacturing, and quality control take a long time, and it's hard to shorten that out. So the projections of what Dr. Fauci says, that it's probably going to be 12 to 18 months before we have a vaccine that's deployable and moves from a vaccine candidate, experimental, to a licensed product, or a product that can be used under emergency use authorization, where we have enough confidence that the vaccine doesn't cause untoward side effects and it might have efficacy. Those things we can't shortcut. Those steps.
Because if you do one that it's only 75% effective, and there's another one that's 92% effective, don't you think we should know that before we start selling the stuff?
And you want to make sure it doesn't have safety problems.
Exactly. What if it has a side effect no one anticipated?
I mean, we were all in the military, guys, and
Yes.
we were getting all these vaccines.
Oh,
saying your military property, you're taking this, and there's risk that later on you can have a third ear on your forehead. But since you're military property, you got
Well, wait a minute. Wait a minute.
You can't tell me you don't remember that.
Wait, I remember. I was in military medical research and development. I remember those days.
I was one you were testing on.
No, we weren't testing. Most of those vaccines, our soldiers, including me, received were licensed. There was a period in the Gulf War that some were used on an emergency investigational.
They did that to us in the Gulf War.
An investigational new drug status, but there was decades of use, and laboratory researchers like me that told us that we understood the safety profile and the efficacy profile, but the vaccines that we get in the military have been FDA licensed. It was just, we didn't like it because we were getting a lot of shots at one time is what we didn't like.
So here's a question for you. So if you're saying 12 to 18 months, 25, he's saying 12 to 18 months. You're saying 12
and I agree with that.
months.
I think that's extremely aggressive because of the phases.
It is extremely aggressive? Or
It
it's
is.
Not?
It is.
Even 12 to 18 months?
Yes.
It is.
Yes.
Okay. But
It
let's
is.
just say they can pull it off because Trump's going to put pressure on them and they're going to do 12 to 18 months. Okay, fine. At what point do you think, best case scenario, we'll have it ready that if we have 1 million cases, we can give 1 million people vaccines? Could that be 12 months from now?
But you don't give it to them when they have you give it to them before they get sick.
So it's
Right, like a flu shot, you get it when the season's coming.
So at some point.
So then that means you have to give it to 100 million people. It's
That's
not like
correct.
you're giving it to 1 million.
That's
Well,
correct.
let me put a perspective on. So some point in this development of phase 1, phase 2, phase 3, there could be some point in a phase through 3 area where we're beginning to see that we're not seeing untoward side effects or safety issues, and we're seeing some evidence that's effective. There could be a point before it's actually licensed if everybody, the scientific community, it would come to a conclusion that maybe this vaccine we can go ahead and begin to use it before it gets FDA licensed under what's called an emergency use authorization, because there is growing evidence and sufficient data that would warrant its safety and efficacy with the risk, an elevated risk. Now, there wouldn't be probably the scale that might be needed, but we could also then think about who would be prioritized to get a vaccine in limited quantities in hotspots. And so who would that be? Well, we are putting our healthcare workers on the front line of this. And so we would have to think about, is it our healthcare workers? Is it the population that's most at risk? But those are some of the kind of ethical questions that would have to be addressed, at that time. And we're going to have some ethical questions right now, and just hospital preparedness as well.
So let me ask you a question. Here's cases. Okay, I'll just give you cases. The number on how it's doubling, you've seen this before. This is okay. So I got a question for you with what we're seeing with charts on assuming these cases keep doubling. And I ran it at 4 days, 6 days, and 10 days. And this is just US. In 4 days, if it doubles every 4 days, we're looking at 8 million cases by May 1st, just in US. Let's just say that's too aggressive, 4 days. Let's take it to 6 days. 6 days, we'll be at 4 million by May 19th, okay, if it's 6 days. 4 million. That's still a big number by 5/19. If it doubles every 10 days, we're looking at September 4th, all of US, July 2nd, 4 million cases. If we got 4 million cases and we use the 2% number, 4 million, 2%, 80,000. 80,000 is 7 times bigger than what we had with the H1V1 in 2009, 2010 with Barack Obama. We had, 57 million cases? I don't know the exact number, but we had quite a... So if we're going this direction, okay? If we're going this direction, and we're looking at the numbers that way, it's going to double at that rate. Okay, we don't have the vaccine. We're not going to have it for 12 months to give it to people, 12 to 18 months. What are we doing then?
We have the drug.
Well, that's why we actually,
need the drug.
I think you're putting way too much emphasis just on the vaccine solution, and that's why.
So we have the solution right now with a drug to fix it?
No, not now. You're putting way too much emphasis on a medical countermeasure as the fix right now, because public health measures are actually tried and true, and we were talking about the community mitigation, community social distancing measures are going to be very effective, and they're buying us some time until the antivirals or the vaccines come on.
That leads me to my next question.
So that's why what we're doing right now in the social community social distancing interventions are essential, because those numbers are kind of frightening, and you're also assuming we'll know the numbers because we have enough laboratory diagnostic capability. But that's another, we can talk about that in a minute. But you're really explaining kind of the classic rules of epidemiology and the doubling and the replication. And this is we are still in an exponential growth phase of what we can see, of what we've been able to diagnose.
Exponential growth. So this is not a linear growth. It doesn't go from one case to two cases to three. It doubles, and then it doubles again, and then doubles again.
Yes.
That's what exponential means, and that's very dangerous. That's why there's a huge risk to this. Jerry this is where we might disagree a little bit. Okay, I don't think the American people in a democracy are going to show the discipline, particularly younger people, to implement. They should. I'm not saying they shouldn't. I'm saying that I think we're going to have trouble with it after 2 or 3 months of this.
Oh yeah, we can't go that long. Yeah.
And if we don't have drugs that can kill the virus, by the end of that period, we're going to have trouble. So I think the most important is not to focus on the vaccine. The president is focusing on the vaccine. That, in my view, that's a mistake, because it's too far into the future. The measure that's going to relieve us and the economy from this, the damage that's being done, is these drugs that already exist. They're simply testing them to see whether they're effective against this disease. That is what is going to allow us to relax these social measures that are the thing to do now. And we need to emphasize to young people they cannot simply dismiss this and go to a bar and have fun with their friends. That does not work. It defeats the whole purpose of this if people behave that way.
I think that part's fine. And I think they'll adjust to that with the bar part, because, yesterday I'm going to eat something, lunchtime, I'm like, let me go to neighborhood services. Oh, closed. It's closed. Then I went to Hop Daddy. We're closed, but you can order and we'll bring the food outside. Okay, it's a sit down place, but I sat outside, they brought the food, I took the food, I came to the office. Okay, that works. If bars start shutting down, people know Friday, Saturday night, my concern isn't that. So what the good news you just gave is that because so many people are just talking about vaccines and we're relying on this vaccine, it's putting the fear in people, assuming that's going to take 12 to 18 months. That's very concerning for the average person.
Sure.
You're saying we made the entrepreneurs and scientists, if they team up together, they can come out with the right medication to help slow it down or do anything to it,
and treat it if people get it.
Yeah.
And that could happen. That realistically can happen in the next 4, 8, 12 weeks.
The problem is, even if they do all this science, there is the issue that the Chinese have effectively, by subsidizing their pharmaceutical industry over the last 10 years, have bankrupted our pharmaceutical companies that produce the basic elements. It's called API, active pharmaceutical ingredients.
We're getting to the bad.
This is the bad. This is very bad.
Is it ugly or not ugly?
Well, it's ugly. I think it's ugly.
Okay, so this qualified ugly right now.
Yes, there's a book called China RX. We didn't write the book, okay? And it's on this subject. It's been a systematic attempt to bankrupt not just American companies, Japanese companies, European companies from producing pharmaceuticals. 80% of German drugs are dependent on China. 80% of our drugs are dependent on China. So if the pandemic continues in China and you're Xi Jinping, what are you going to do? Export all those drugs to the United States and Europe? No. You're going to keep them inside the country and treat your own people. I would expect him to do that. But we have allowed this to happen. This is a national security issue. I am for free trade. I actually believe globalization is a good thing because it's taken millions of people out of poverty. It's reduced costs. It's improved the quality of products. It's made a globalized world. A lot of people hate capitalism, and I'm not one of those, okay? However, we don't allow our defense, our weapons systems to be produced in other countries. There's a reason for that, because it's a national security question. We need to produce those weapons in the United States for our military. We need to do that for pharmaceuticals as well as Jerry said earlier, medical disposables, like the face masks. We don't have enough ventilators now. So there are measures that affect the survival of the American people, and there needs to be a complete rethinking of this. Now, did the pharmaceutical companies deliberately try to bankrupt themselves? Of course not. They didn't do that. The Chinese did it by subsidizing their own pharmaceutical companies to become the dominant force in pharmaceutical, active pharmaceutical ingredients which are necessary to make the drugs for the whole world, not just for us. And we need to address this issue, and that's not for right now, but it's soon. We need to deal with it soon, because if we get the drugs, the question is, we get the drugs approved through these scientific tests, we then have to produce them, right?
Can we?
Well, can we produce them? I don't know. I don't know which drugs are produced where. We'll find out pretty
When you
quickly.
say, I don't know, what do you mean you don't know? Like, we literally don't know?
No, I'd say we've just we've offshored a lot of our pharmaceutical manufacturing, biologics or vaccines, antibodies, not all, but we've offshored a lot of our actual manufacturing. We have a very, very strong research base in the United States and kind of early discovery and early development, but we've offshored a lot of manufacturing, and we need to bring it home.
So I'm
going to say something about the vaccine too, because we need to, this COVID vaccine that is being developed, one of these candidates is going to be successful, I hope. And we need to make sure that we, whatever one is successful, or several that are successful, we need to make sure we're manufacturing here at home. And this vaccine will be important in 18 months or whenever it does get licensed, because many believe that we will get through this. I mean, there's going to be this epi curve if it's 2 months, but it may come back and it may become endemic, and like other viruses become. And that's when the vaccine is going to be very important if it does become endemic.
Can you break that down for somebody that's not in your world?
Yeah, so if we look at compared to influenza, and so we have many circulating strains of the influenza virus. And
influenza is the flu.
Is a flu, and so we have flu is all these different strains are endemic in our society, and every year we have to really develop a new flu vaccine every year based on the circulating strain of flu in a given year, given season. And so flu is endemic. It continues to evolve genetically, and that's why a new vaccine is always needed. So this virus may act similarly to that. We don't know yet, but because it is circulating around the world already, almost every country now has got coronavirus, and we're probably not going to be able to completely get rid of it. And so therefore it will probably be in our at a much lower level, and it may peak up at some times, but a vaccine is going to be very, very critical for us to have in case it does become endemic. Usually as a population, we're kind of getting back to some herd health, and population will begin to develop some immunity just by natural exposure to it, and some of the population will become if we were to get infected, then hopefully our signs are less severe in the future.
So it sounds like you like what UK is doing. I mean, you're going
not urgently,
indirectly.
No.
We want herd immunity, but not this way.
In the long
not
term.
The way they're proposing.
Okay.
In the long term.
So in other words, what you were talking about is the fact that the virus is constantly evolving. So if it's constantly evolving, we have to also make sure the vaccine is constantly evolving.
Well, that would be. So we don't know enough about COVID, and it may not evolve as rapidly as
what doesn't
flu.
evolve? Is there a virus that doesn't?
Measles is a very stable
Doesn't
Right.
evolve. It's pretty much
Very
the same.
stable.
So if you had measles when you were a kid,
Yeah.
and you didn't because you didn't get the immunization, the vaccine, you're not going to get measles the rest of your life, because your body your
body fought it off.
That's right, and they've developed antibody. You know where we store our I did not know this until my wife became ill. We store our antibodies in our bone marrow. So our Army, our Marine Corps, our 101st Airborne is in our bone marrow. Wow. And when a disease,
I like bone marrow.
when the disease comes out, the army of antibodies says, this is disease in here, we're going to kill this thing. And they march out and they search all over our whole body and they kill all the viruses. So that's the whole idea of a vaccine. You want to build up the antibodies before you get the disease, so you don't have to get it to develop the antibodies. So two ways to develop the antibodies. You can get a vaccine, which doesn't give you the disease, or you can get the disease, and that's how you get protection.
Let me go back to the question with the medication you were talking about. Okay. How fast, if we are absolutely crushing it, how fast can we come out with some kind of a medication to help with coronavirus?
I think that's going to be very fast. I'm not going to give you a month, other than in a range of maybe 2 to 6 months.
2 to 6 months.
And that's what I'm hearing.
Okay.
And that's because we're able to repurpose antivirals that are already FDA licensed are in development, well down the development pipeline for other indications.
For other diseases.
Other diseases.
Right.
Okay, so 2 to 6 months.
Yeah, and that's those are some of the estimates I've heard from others as well. But that's only because they're already licensed for another indication, and initial data looks like they may be effective against COVID, and so these could be repurposed relatively quickly. If all that, the clinical trials, prove out to what the data looks like right now. I don't know the information of, how available, how much, how large a manufacturing base is for those antivirals. But I know that has to be being looked at right now very, very seriously.
Okay, so you're saying you started off with the good news, and you've gone back to the same word multiple times, both of you. You're sticking to your guns, social distancing, right?
That's the only tool we have at the moment.
Is it fair to say you're above 50,
What do you mean?
age-wise?
Oh, I'm in the vulnerable population.
So I wanted you to say it. Okay.
I'm 70. I'm 70 years
Okay,
old.
I wouldn't put you at 70. I'll put you at a different number lower than that, but okay.
I was going to say, well, that's good. I thought you were going to say
I know,
80.
that's why I said about 50. So if you're saying social distancing, why are you sitting so close to me, and why are you getting close to 5 other people here?
Because there are 2 million people who may listen to your program and listen to our advice and stop infecting other people by listening to what Jerry and I are saying in terms of social distancing. We didn't drive 3 more hours up here just to be seen on TV. We go on the TV all the time. But your program is devoted to this, and we're hoping some people will take the advice, particularly younger people, and be more restrained in interacting with other people. And by the way, the president's instruction, which comes from CDC, from our scientists, say groups smaller than 10. We have not met 10 people today. We
Can you
didn't
go
even
get 5 other people in there real quickly?
No.
we did not stop and eat because of this. We ate before we came. We're going to eat when we get back home tonight.
Okay, so this leads me to the question I've been trying to ask you this entire time. So if we go at this pace, social distancing, okay, so if profits for companies go lower and lower and lower and lower, you know what happens? Yep. Companies have to lay off.
Right.
So you saw the article on CNN, which the experts are talking about unemployment can go to 20%. I'm sure you've seen that. Okay. So when's the last time we saw 20%? A long time ago. I mean, we're talking about Great Depression, 20%. Right. Okay. So you look at this and you say, okay, there's 2 communities. You know how they say people vote with their pocket? You know how they say people vote with their pocket? I think people also do research or data or anything also with their situation. Let me explain it, and please challenge me here if I'm wrong. Okay, so if I'm 70 years old or if I'm 60 years old, I'm probably telling everybody social distance, okay? But if I'm 30 years old and I got a wife and 2 kids and I got a $2,500 mortgage payment, I got a job and expenses with only $25,000 in the bank, I can't social distance for too long. So I'm sitting here watching these 60, 70-year-olds keep constantly saying social distance, social distance. You already have your pension. You already have $1 million that's going to pay you for the rest of it. You're already relying on a retirement from the military. You can social distance. I can't social distance. You put me in a tough position. What do you say to that community?
Yeah, well, but wait a second. This person, most people don't work for themselves. They work in an institution. Who's the CEO and the vice president? They're probably older people because people have to have experience to run. You start killing off the people who are running American industry. Now, some people who are hostile to the American system say, well, let's kill all the capitalists off. We want all the CEOs, the vice presidents, middle management. No, I'm not saying you're saying
I'm saying if you're my CEO, I'd say, dude, go home. Go stay. You go home. Let us run the company. We got jobs. We got to make money. But don't because you want to stay.
Because they cannot isolate themselves from every single older person in the society. It does not work.
They cannot isolate. No, I'm not talking about isolate yourself. I'm telling you, if the 70-year-old...
Well, that's what you have to. If you're telling the rest of us, anybody over 50 years old or 60 years old, that they should stay home this whole time, that's what you're saying.
No, you're saying social distance. I'm saying, say social distance to people above 50. But the people that are less than 1% risk of dying, let them continue the economy going. Because if we had 20% of unemployment, you know what comes after 20% unemployment? If you go to look at the cities that is the highest level of crime, what do they have in common?
Well, I know what you're. I know the economic.
So you know how the economic consequence of this could be. So the risk we're taking is we're assuming we know how bad this thing could be. We have some data to show based on the cases that it's less than 1% for people below 50. Maybe UK is taking a decent approach that we ought to consider with people below 50. That's all I'm saying. So if you are the CEO of a company and you're 70, listen, sir, thank you so much for the job. You
There
stay
are-
home, you run conference
The
calls.
problem is there are a lot of people under 50, which is what we're seeing in Italy now. There's an uptick of people in their early 40s and late 30s being hospitalized in Italy with severe consequences from this virus.
A professor told me that that's due to high blood pressure because of 75%. I don't know, I need to introduce
Correct.
you to this
And
professor.
guess how many of the 30% of Americans who have high blood pressure are younger? And how many Americans are obese? You know how many Americans are obese?
It's a very big number.
35% of the
It's a very
population.
big number.
And they're not all old men.
You're right.
Okay, or
it's
all
a very
women.
big number. I
Okay?
can't dispute that part.
And so there are people get cancer who are young. They have HIV/AIDS. I mean, they may be on antiretrovirals now for that. Okay, so there are people with other comorbidities, other diseases, diabetes, that make them more vulnerable, and they are underage. It's not just by age. It's not just by age. It's also by these other diseases.
A big factor of it is also age, though. When you look at it, I know what you're saying. I know I saw the asthma part, the high blood pressure, obesity. You're seeing this data that's coming
Sure.
up. Yes, but there's still an opportunity to continue the economy going if we got some people that can go back to work and continue their jobs. Because, we had a guy that called me and says, "Hey, Pat, we had one of our guys." He says, "We had a person that was here who they take a lot of what do you call the students that come here that they're not from U.S. but they live with them. What did it, international foreign exchange students, right?
Yes, yeah.
So foreign exchange students staying with us, and one of the foreign exchange students that had stayed with them was from China, right? So next thing you know, he came here, he went and visited a family, came back somehow, some way, they ended up getting coronavirus. So I said, okay, I had it. What did it feel like? Dry cough, et cetera, et cetera. I was feeling the same thing. It was 2 weeks. It was stronger than the flu. I kind of had no clue what was going on. Then I realized that's what I had, but I'm over it, and I experienced it, and I'm gone, right? To me, my wife and I are talking. Please challenge me on this as much as you want. I am wanting you to challenge on what I'm about to say here. My wife and I are sitting down. I said, babe, listen, here's what's going to change this challenge that we're facing today, okay? And this isn't even my main question I want to ask you this entire time. My main question I'm going to get to here in a minute. I said, babe, the world has to see thousands of people get coronavirus on the news, on TV, on YouTube, doing a video saying, I have coronavirus. Here's what it feels like. This is what I'm going through. Here's what I'm doing. So if anybody's watching as they got coronavirus, the best thing you can do to help the world is document it and put it on YouTube so we can see what you're going through. Here's a symptom. This is my age. This is what I weigh. This is my height. I need to be this weight. I have been diagnosed with high blood pressure. I've never been diagnosed with high blood pressure. That has given us intel. So once the world kind of sees all this data and comes back and says, okay, it's a virus. It's bad. We got to be careful. But you know what? We can get past it if we get it as well. So then comes the acceptance that we can overcome it if we do get it. What is your thoughts on the way I'm viewing this? Because any other way, I'm seeing us going like this till the end of the year, because if we don't find this in the next 6 months, 20% unemployment may be a small number compared to where it could be 6 months from now.
Well, every epidemic, and you've seen Dr. Fauci talk about this. It's this epicurve, and what we're trying to do is flatten that curve, because the consequences of that curve being very rapid and very steep is that you are going to have a lot of people from the 18 to the over 60. They're going to fall in this critical category. And we are going to have a higher death rate, whatever the age may be. And we're going to have our hospitals overwhelmed. And you're going to have physicians have to make extremely difficult decisions, who lives and who dies. And actually, I think it would be a good idea if you could probably interview some children and young kids from Italy who actually probably had to deal with their parents dying in Italy to COVID, and probably not even being able to see their parents buried. And so this is going to have huge impacts on kids and young people when they lose their family members. And so that's something that needs to be thought about as well. I get your point. The economic impacts and younger people. It's a very, very good question. But I also don't want to see our country end up where we have our ICUs and our hospitals just completely overwhelmed, and we're having to make decisions about who lives, who dies, and crisis standards of care, And that would be a fundamental shock to our country if we got into that kind of situation. And that's what's happening in Italy right now.
That's the difference between an 8% death rate in Italy, which is extremely high. It's 3 times higher than the flu was in 1918. And a 1% rate, less than 1% rate in South Korea.
And remember, we don't know really what the true death rate is.
Right.
Because we don't know what the denominator. That means we don't know exactly how many number of cases there are, because we don't. Italy has more diagnostic capability than we do. But even if it's 1% in a given community, that can overwhelm a hospital system, a system in a given community where attending physicians and so forth are having to make these very, very horrible kind of decisions.
South Korea is fine because I think they're number 2 in the amount of hospital beds per 1,000 people they have. And Japan is number 1 on the list for, I think, 13.03. I think South Korea was like 12.05. And in U.S. is like 2.8 beds per 1,000. We have 924,100 beds, of which 60-something percent is being used. We only have 300,000 available beds. And then outside of that, the ventilators, the machines that we keep hearing about, that we don't have that many of that available. New York Times yesterday just said that New York needs 18,000 of those in the next 2 to 4 weeks. So that part I fully see as a big challenge of not having the capacity to handle.
And I don't know who's going to run those ventilators. The other part is the healthcare workers, having the respiratory technicians, having the the pulmonologists. And
I don't worry about that part. You know why I don't worry about that part? Because the two of you have experience where in the field. The other day I interviewed a sergeant major of Iraqi military. Yeah. He was a 19-year-old sergeant major. I said, how the hell are you a 19-year-old sergeant major? He says, when Saddam fell and Iraq started the new military, they only had 25 soldiers and nobody wanted to be a sergeant major because you were the number 1 person they wanted to kill. And I said, I'll do it. So I became a sergeant major. You know how back in the days, hey, you're a corporal. I haven't done the correspondence. You're now a sergeant. Hey, you're a sergeant. People were getting promoted in war. So I think that's not really the big concern from my end. The thing, the way I'm processing this with the economy is, are we comfortable the economy fully going into shambles? Like, the part that concerns me, I remember in Army, I think you had to be younger than 35 to join the Army. And the reason why I remember this, I had a guy in my camp, at my boot camp, who had been in the Army before. He got out, but it had been 10 years since he got back into the Army because he owed like $40,000 of credit cards and the Army agreed to pay off his $40,000 of credit card. But he was 34. And he told me the age was 35, right? So why is it 35? Why can't a 50-year-old go to boot camp, right? A 50-year-old doesn't go to boot camp, but military says, listen, we just don't want a 50-year-old going to boot camp. We want the oldest 35. And if you think about going to war, how many people go to front lines? It's not the 40-year-old, it's not the 50-year-old. It's the 22-year-old, 18-year-old, 11 Bravo that's going to be at the front lines. Why not treat it the same way? Let the younger guys that are driving the economy, let them go to work and do their part if their immune system is that strong to it. Because if we don't, and this thing goes the way it is,
you know, one of the things that's going to happen here, American capitalism, there's a reason why it's a superior system to government-run businesses in China, for example, is they are extremely adaptive. For example, businesses, restaurant, my Greeks are in, I'm a Greek American, Greeks dominate the restaurant business in the United States. They're finding ways now to say, okay, you can't come to our restaurant. Choose what you want online, and we'll deliver it. And I'm getting more and more emails from the restaurants. My wife and I like to go out to eat. We haven't started doing it. We're going to start doing that. Okay? So there are ways to adapt. I thought all the universities were going to have to be closed. I learned how to use Zoom. I did not know how complex Zoom is. But you can run an entire classroom from we have to have etiquette. Because one of the professors was saying some of the kids did not know that you could see them, and the men weren't wearing shirts, or they had inappropriate pictures on their walls.
The men or the women?
The men. Men shouldn't be, because you can see the picture. Yeah. Everybody can see.
We have a guy who does that. Hector's his name. He likes to wear the tank tops.
Well, I'm going to tell my kids they got to be properly dressed and no inappropriate pictures on the walls of the room in which they have the Zoom going on. These are sort of etiquette things. Never even occurred to me. But I got training for 2 hours yesterday, and I'm 70 years old. I'm adapting to this new distance learning, they call it. I never thought I would use distance learning, but I am going to do it Monday morning.
So
and we understand the economic impacts.
Oh,
We're not
well,
saying
I'm
this
not
one.
minimizing
In fact,
that.
this is going to be part of our research in the Pandemic and Biosecurity Policy Center for years is trying to understand the economic impacts of this. We have to find ways to try to mitigate the economic impacts. It's not going to be easy. You can't separate the two. These are going to be tough challenges, and the administration actually is trying to find new measures. They are, and Congress, they are beginning to address this. Is it going to address everything? I'm sure it's not. Are we going to address everything we need to do for the COVID from a public health medical perspective? I'm sure we're not. And so both have got to be tackled and tackled very aggressively.
So I'll give you the flip side. Again, I'm going to keep challenging you, and you guys. I've been challenged by doctors and professors my entire life, so I enjoy it. Okay, it's like
we do too.
This is what I look forward to. Okay, so you said Greeks, restaurants. We're going to do it this way. Teachers, you're 7 years old. Yesterday, you're learning how to do Zoom, and you got to make sure that these guys put a shirt on before you can teach them whatever you're teaching them. Right? Okay,
I'm being
guys,
a little
put
bit
your
humorous
shirt on.
now.
I
Okay.
get it. I'm giving you a hard time. Believe me, I give one of my guys a hard time. I'm going to hear from it. But how do I Zoom someone on a plane to New York? How do I Zoom a gym that is filled with so much metal where they're saying that the coronavirus can live on a metal for 12 to 24 hours? How do gyms Zoom? How do many businesses that you have to Zoom? I mean, I understand Zooming if I'm a personal trainer, I'm fine. Mm-hmm. I understand if I'm an accountant and I'm Zooming, I'm fine. I even think doctors can Zoom because there's business models right now that is built on that, but not every business. Yeah, not every business.
So, I know, I understand that.
So how do you explain that to the flight attendant that's making $59,000 a year saying, what do I do about
this? There have to be federal interventions, and that's what they're talking about. I have to say, given the very, very partisan nature and polarization of our political system, I am shocked and pleased at how much the Democrats and Republicans are getting together to address this challenge now. The partisan rancor seems to actually have diminished, like it did during World War II. So they are beginning to get stuff done.
That is a great thing to see.
Really
You're saying like Cuomo, Governor New York, and tweeting out, and you never thought that was going to take place under Trump.
Never. So I think when you're challenged with something of this magnitude, then people start getting together, and there's a lot of things that can be done if people put aside the egos and the partisanship. Now, it's unfortunate it's a presidential election year, but that's what it is, and that's the way it is. But
you still didn't answer my question, though.
Well, but some of these things you cannot fix. The airlines are in big trouble. We don't want the airlines to go bankrupt. I understand that.
You saw Boeing. Boeing needs a bailout, right?
I go on planes all the time. So does Jerry. We're traveling constantly. So we don't want the planes go bankrupt and the economy recovers. We need the airlines to be whole. So there are a lot of things that have to be considered. Small businesses have to be considered. What the consequences for small businesses in the United States.
I'll give you the last crazy one.
It's not going to go on forever. It's not going to go on forever. But we got to mitigate its severity, and we got to mitigate the economic impacts. No doubt about it.
If we don't find a medication for 2 months from now, and vaccines not here for 12 to 18 months, and they're still preaching social distancing, and now they're paying $1,000 a month to every American. That idea was brought up by Andrew Yang, which was a back in the day negative tax that Milton Friedman used to talk about.
That's right.
I mean, then, it's going to be another month and another month and another month, right?
Where the social distancing, the peak, there's always in an outbreak, it's going to go up and it's going to come down. And we are trying to mitigate the peak of that outbreak. So it's lower. And the social distancing measures are going to be needed just long enough to lower the peak before they can be pulled off. Social interventions are not going to need to be going until we have an antiviral, until we have a vaccine, because the peak will come down at some point when there's enough people infected. So at some point we're going to be able to pull these off. But right now we need to be really aggressive, and we have to think in terms of weeks rather than days.
So the Orthodox Church I go to, the Orthodox never change anything. It's the same as it's been in the first century, which is why I like it. Okay, all right, we have a young priest. And I said, Father, we can't have services now. The archdiocese has said no services. All the altar boys and the choir and the priest, and that's it. I said, well, what about the rest of us? He's putting in maybe I shouldn't say this in the area, he's putting in a TV camera that we can all participate in the Divine Liturgy, which is a very calming thing. If you're under severe stress, your religious devotion makes a difference, calms people down.
100%.
So he's going to put in a very inexpensive, and he's going to in real time. Now we won't be able to take the Eucharist, but it's a very innovative way of using technology. My wife's Catholic. She's doing her church is doing the same thing.
Has the priest on the Catholic side, has the level of forgiveness gone up? Are they a little bit more lenient right now than before? Father, I have sinned. He's listen, right now everyone's forgiven. Don't worry about it. But if your priest is able to Zoom heaven, his church is going to blow up. If he can Zoom heaven right now, it's game over, right? Let me tell you what I've come up with. You want to talk to your grandpa? I have him right here with me.
That's game changing.
That's game changing right there. Everybody forgets about everything else. So, look, my concern with the economy is you're in the world, and I'm trying to see what you're thinking about with this whole thing, because I also remember there was a time where under another administration, I think it was in 2011 or 12, where unemployment benefits were paying out for 24 months. If you remember, it was 24 months. And then they kept saying, well, people can't have a job. And at the moment unemployment went to 12 months, next thing you know, everybody started applying jobs and getting jobs. So my concern is also if people are not working and we're just kind of subsidizing and they're getting, giving them money and they're taking care of everything for them. Then when it comes back down to going and work, then they're not used to working 40, 50 hours a week. What are we going to do after that?
Yeah, but the data shows from previous epidemics that it's a V curve or a V. So the economy collapses and it bounces extremely quickly back up again. It's not like we had huge structural problems with debt in 2008.
I've seen that data, yeah.
This is not the same thing as 2008. It took years to rebuild the financial system. We're not facing that in this case.
2008 is greed. 2008 has nothing to do with this. This
I know,
this is more 9/11 than it is 2008.
That is exactly the point.
Yeah.
That's exactly the point.
Yeah.
We're not facing a 10-year recession or a 5-year recession. It's going to be a quick rebound after we get control of this. And
so that's good news.
That's very good news.
We got some more good news.
That's a very good news
That's
to end
good.
this on.
We got some good news on this news. Now, guys, I'm hoping you have the insight on this because God knows how many memes are blowing up right on Instagram. What the hell is going on with these toilet papers? Why toilet paper?
I don't know why.
I'm not getting this toilet paper stuff.
I'm not either, frankly.
I understand some of the things at the supermarket. Okay, so we went in and we didn't overbuy. It's just my wife and our kids are grown up. So the only thing were green apples. The green apples were all sitting there. I said, people must not like green apples. Okay,
that's concerning. Well, maybe there's something
about the green apples. There are no potatoes left, no onions. Onions for me, the big thing. Onions and the garlic. If the garlic ran out, I'd have big problems eating.
You and I both.
Okay, yeah. So you go down. The fish is all there. There's no problem with it because the price is so high. Okay, no chicken whatsoever, no turkey whatsoever, and no beef. The only thing that was left was a little pork. I thought that was interesting. But then you go down to see the toilet paper and the hand towels, the sanitizer, and the sanitizer. I've been trying to get sanitizers, not just one bottle, for 3 weeks. I go in early in the morning. I go in late at night. I said, when is it? So, well, you're in the wrong place. I said, I come in 3 times a day to just check. I can't find it. So it's. I understand why they want the sanitizer. I don't get with the toilet paper. I do not understand that.
Do you have a theory on it or no?
My only theory is that I think most people don't understand that this might be weeks, not days. And just like before a hurricane, we all run to the store and buy milk, eggs, and toilet paper and water. And so I think many people believe this is kind of like, we're preparing for the next storm, and we are, but it's just going to be more prolonged. And I think what people don't understand is we don't need. In fact, please, people should be encouraged not to go hoard. Our critical infrastructures, to include our grocery stores, are not going to shut down. And the critical infrastructures that produce the same things that go into our grocery stores are not going to shut down. Society is going to make sure that we have these critical things continue to move forward and function. And so our store, they're not going to run out of toilet paper. And I think our society just, thinks this is another hurricane. And that's a good analogy, but it's just going to it's going to last longer, and it's not like things are going to be destroyed.
Well, the way you're saying it, I would even go to the store even more. Because if you're telling me
it's going to be weeks, but the critical infrastructures are going to.
I'd go to Costco right now and get off.
But you don't have to eat any more food.
They're going to be restocked. They're going to be restocked. They're going to be restocked and restocked and restocked.
Sure. So you're not going to need more food because of the virus.
Yeah.
Okay, and you can still go shop.
You're not going to need food because of the virus. You're not going to
need any more food. You're going to eat the same amount of food whether there's a virus or not a virus.
Yeah, but if they do shut down, and next thing you know, they're
not going to shut down the grocery stores.
They're not going to shut the grocery stores. They're not going to shut the grocery stores. They're not going to shut down the industries that are producing the food and other supplies that go into our grocery stores. And so there's really no reason to be hoarding like they are. Really not.
I got a different kind of a question for you. What are your thoughts about if coronavirus happened in 94, not today, okay? So go to 94, no Facebook, no YouTube, not even MySpace, no Twitter, no Friendster, no nothing,
Zoom.
no Zoom.
Skype.
That's right. You would be struggling if there's no Zoom. So no Zoom, none of this stuff, 94. News doesn't go like this. You don't just go all of a sudden, boom, update, notification. If this pandemic happened in 1994, how different would have the people reacted to the way media keeps saying, end of the world.
By the way,
what would have been different?
We need to stop using apocalyptic language.
Correct.
Okay? This is
Tell the media that.
Well, I know that, and they are being apocalyptic about it. I wrote an article, actually it's called for Al Arabiya, which is the U.S. government's Arab language news service for the Middle East and North Africa. They asked me to write a column. As a former AID, it's not well known in the United States, USAID. American people don't know all the good things they do around the world. But in the Arab world, AID is very well known. So they said, would you, as a former administrator, write something? Because people don't know what's going on. They're afraid. There's panic in the Middle East and in North Africa. And I said, sure. So I wrote it, and I said, there are two dangers here. One is to understate the risk by dismissing this and not listening to the experts like Dr. Fauci. And the other is to suggest the apocalypse is upon us and the world is about to end. It's not about to end. This is nowhere near what it was in 1918, where 5% of the world's population died in 6 months. We didn't even know what a virus was then. We're just beginning to develop the germ theory of disease. Okay, they used to think that it was swamp gas that caused illnesses, and they were still bleeding people 100 years ago. They thought the problem was too much blood, or there's something wrong with your blood, and they would bleed you as a way of treating a disease. That was 100 years. So we have a much more advanced system. Now we have science, we know a lot more, and we also know how to produce vaccines. We weren't producing vaccines 125 years ago the way we are now. So, and advanced medication. Most of the drugs produced in the 19th century, early 20th, they were jokes. They weren't serious. In fact, they hurt you if you took them. Yeah. So we have a much more advanced system. We don't, and that means we can respond. And the structures of government are much more sophisticated, even though people get disgusted with the government. You know who's going to be the big solution of this? People talk about the Chinese model working, and all that's baloney. The Chinese model is not a superior model to our model. Our model is highly decentralized at the state and local level. Most of the response is not taking place at the federal level. That's the most visible because the news media folk. It's what the 50 governors are doing, all the mayors, the boards of selectmen in New England, where I originally came from, the county judges in Texas. They are the ones who run the systems that we actually connect with. Who runs the school systems? The federal government doesn't run any schools. How many universities there are? None. How many factories do they run? It's a highly decentralized system. And what's amazing to me is if you watch what's happening across the country, people are simply saying, I see the threat, I'm the leader of an institution, I'm going to protect my people, which is my job, and that's what they're doing across the country. So what's going to save?
That's the good news.
That's very good news, that we as a democracy are taking responsibility at our own level, not saying, well, we're going to wait for someone from Washington to tell us how to fix this, which is not a good idea.
That's what we did yesterday. We made a list of people that have kids who they can't find people in daycare to take care of them, so they're working from home. And folks that are above 50 years old are working from home. And then we made a list of anybody that's pregnant, anybody that has any kind of a health based on the conversations that they had. they're all working from home, and we're going to have a few people that are working from here. We made that decision yesterday, so I agree with that. But the question I want to ask you, in 94, would the U.S. government in 94 have reacted the way we are reacting today with the amount of fear that's in people right now because of social media? Would the steps and the way the government reacted in 94 been the same as it is today?
Actually, is it social media that's driving some of the fear as opposed to public health authorities and media? Because I think a lot of actually the Director General of the World Health Organization described before he declared a pandemic that we are actually in an infodemic. And so what we have now is we have an infodemic
100% I agree.
of so much misleading information, fear-mongering, and trying to get anxiety and worry in people. And so it's infodemic, and it's the fear is actually much worse than COVID. And so somehow we've got to do a better, that does tell me that we need to do a better job as a society in risk communication and communicating, what the risks are and what we're doing about it, and counter this misinformation that is an infodemic. So social media, maybe we would have been better in 94 without the proliferation of social media.
That's what I'm saying.
Well, I agree with that. One of the things that's happening is people are taking advantage of this to make money. Apparently they confiscated fake testing kits at one of the ports, federal authorities.
Where at?
I think it was in Los Angeles, wasn't it? It was on the West Coast somewhere. I saw it this morning on the news. It was very interesting. Someone has produced it's not a test kit, but it looks like one. And it's a fake, and people are trying to make money on it. There are people running around saying that if you can hold your breath for a certain number of seconds, that you don't have the disease. That's complete nonsense. Does it damage your lungs in the later stages? Yes, but by that time, frankly, you're going to have testing that can tell you have. Holding your breath is not going to tell you whether you have the disease or not. The third thing that I've heard now is that if you breathe in 133-degree steam into your system, it will kill the virus. That's utter nonsense. You could singe your lungs if you do it. I don't know how bad actually I've been in 133 in Kuwait. So actually I survived, but that's not going to kill a virus. It's ridiculous to talk about things like that. So people should be very careful. If you want to find out what to do, go on the Center for Disease Control website. They give you advice. These are the top scientists in the United States.
You really need to keep doing that, driving people to authoritative sources. And actually, I would actually encourage people in their communities, wherever you may live, is go to your local public health website first.
Right. Good idea.
And because it's your local public health, your local emergency management, your local community has got the most authoritative, up-to-date information for the community you live in. And then the CDC has got the most authority, and they get their guidance and recommendation from the CDC and then apply it to their local communities. But anything you can do to continue to promote people going to authoritative sources of information would be very good. We're actually looking at a group that does kind of artificial intelligence, has to look at social media, but we're trying to perhaps use a group that can help us identify how misinformation is bubbling up through social media to also kind of counter it with the right information.
Who's we, by the way, when you
say I can't talk because it's a proprietary company.
I can introduce you to somebody.
Yeah.
You can I would love to do that.
I would love to do that.
Offline, we can make an introduction to somebody.
That would be fantastic because we need to do that and try to put some countermeasures of vaccine against social media, bad social media, because social media is also very important too. It's a good way that we communicate and get information out, but we just have to counter the misinformation.
There is a statement now I've heard on this, that this was all a conspiracy to defeat the president. Regardless of that's just nonsense. Do you think that the Italians created this, what's happening in Italy? You think it's all made up? That's ridiculous. The Chinese made up 80,000 of their people dying and a collapse of the economy in order to affect our presidential. That's not what's happening. So these conspiracy theories on the left and the right are not helpful. Well, you can't tell people to stop doing it. They'll do it anyway, but I'm just telling you it's not helpful and it's nonsense. This is a real problem. It's a crisis. It is not the apocalypse. So we can't create public panic. On the other hand, we need to take the steps necessary to get this under control.
Who's the big whistleblower? The two big whistleblowers. What are their names? I'm curious to know if any of these whistleblowers are coming out and giving any kind of insight Because eventually some of this news is going to come out. You know, the main whistleblower in China was a doctor who came out saying this is bigger than we think it is.
Yes.
And then he died. He died from
Yeah, it was
coronavirus
egregious.
himself.
That was egregious.
Personally, he's 37 years old.
He wasn't in a high-risk group.
I don't think he was in a high-risk group. I think they.
You sound like a conspiracy theorist.
No.
man.
The question
why
is,
are you
how did a
spreading
36?
conspiracies?
Why did a 37-year-old die?
Can't believe this stuff. Do you realize we just went from don't buy these conspiracies?
Well,
But to go there with you, I am not far from where you are, okay, with what you're saying. So we're on the same page. What's your opinions on China? I've had General Spalding here, who was a general in the Air Force, and he went in.
Oh, yeah, I know who he is.
You know what he did. He
I
did
don't
some
know him
work
personally, but I know
he
him.
did some work on China, and he came here, and he held nothing back on China. Nothing. He talked about 5G's effects on what they're trying to do with Made in China 2025, how they want to take over the world, et cetera, et cetera.
Well,
there was no filtering there.
but
What are
don't
your
think-
thoughts on China?
Yeah,
What are your thoughts on
I think
China?
that we are exaggerating. Let me tell you, I'm 70 years old, so I remember when I was in my 20s, articles in all the news media that the Japanese model is going to take over the whole world. Even a country of 100 million people, how they're going to take over the whole world. And the Japanese model, their industrial system is far superior to us. You read anything like that in the last 30 years? No. Why? The Japanese model had deep problems with it. So does the Chinese model. Do you know what the Chinese have? They have a highly educated technocracy. Very gifted scientists, very smart people. And they're good business people. And they've collected a lot of money. They got $1.5 billion, most of our dollars in their sovereign wealth fund, okay? You know what they have that we have that they don't have? We have very strong, highly functional, resilient institutions. You know what makes a society, and this is what I teach in my courses. What's the difference between a poor country and a rich country? It's not they have riches in the rich country, it's they have institutions that produce wealth. The Chinese have weak and corrupted institutions. They're trying to fix them. You know how many law schools there were in 1980 in China? 4. They had 2,000 lawyers in the whole country. You cannot have a modern economy without a legal system. No rule of law, no economy. You have to have a rule of law, okay? Milton Friedman assumed when the Soviet Union collapsed that all they had to do was free the markets up and everything would be great. At the end of the 1990s, he was at the Cato Institute, a libertarian institute, he said, we made a terrible mistake. No rule of law, no economic growth. And there's a whole school of institutional economics that say that. The Chinese have profound dysfunctions in their system which we are not seeing. We're creating a threat. Is there a threat? Yes, there is. We need to deal with it. We're seeing it in the pharmaceutical industry. We need to directly address it. But let's not make some mythological, powerful figure out there of a country when in fact they have deep internal problems. And they, by the way, they recognize it. If you talk to Chinese privately, they'll tell you it. If you go on, I don't read Mandarin Chinese, but some of my friends do. They said you should see the rage of the Chinese people against their own government. It's unbelievable. They're saying things they would never say in a totalitarian or autocratic system because of the level of anger. They believe the government lied to them. They believe that they knew about this. It was going on for 2 months before they did anything. And they're there's a lot of anger. There's a lot of fear in the Chinese government of an uprising in China, like they had in Tiananmen Square. It wasn't, by the way, just Tiananmen Square in 1979 when there was an uprising in China. It was across the country. The center of it was in Beijing. They're afraid of that happening again. There have been 4 shocks to China in the last year. This is the 4th one. They had this shock with the African swine flu. Pork prices are up, which is the principal source of protein there. 130, 140% rise in prices in China. That upset people a lot. You know, there were huge price increases before Tiananmen Square. That's one of the things that drove it in 1979, the uprising in China. Same thing's happening now with price increases. And you have a lot of money being spent to keep factories producing things that no one wants. Why are they doing that? Because they're afraid of unemployment causing social unrest in the country. So they have a lot of internal problems, but we do need to understand they've been manipulating the international system against us. The Russians are doing the same thing. They're using social media to defeat us. And we need to be more aware of it. Half of the anti-vaccine movement is coming from Russia, from these Autobots. They're attempting to turn Americans
Social
against...
the social media misinformation campaign.
That's exactly what it is. They're running around saying the U.S. military planted this virus in China. That's a bold-faced lie. It's absolutely outrageous. Why are they doing it? They're trying to deflect attention from their own failures in the early stages of this. Now, did they act later? Yes, they did, but the thing was loose for 2 months. What were they doing those 2 months? Nothing. They're suppressing the information. A democracy cannot suppress information because free press, free associations, civil society, all of our institutions just don't permit it. You cannot suppress information in a democracy.
I don't trust any country that is ran on a one-party system where there's no free press or free speech, where the country controls the data. I don't trust any of it. China's been saying their unemployment's been between 2.8% to 3.2% the last 30 years. You're out of your mind to say you're employing 1.5 billion people and only 3% of them don't have jobs. So, what I'm concerned about, why is there a community of people in America on media that are constantly protecting China? I've had so many strong debates myself with some of the most powerful people in the world that protect China, and it goes over and over and over, and they keep protecting China. Why is there a community protecting China? I don't understand this part. What's your opinion on it? You're around it all the time.
Well, there are some people who have vested interests, economic interests, intellectual interests. They may have friends in China. They may be dealing with the Chinese government. That's one group of people who have a conflict of interest.
I understand them, by the
Okay.
way. I actually understand them. Let's set those aside.
There's a second group of people, and I have some friends in this community as well, who say, if we start provoking the Chinese and they're really suffering internal problems, they could become extremely aggressive internationally. They have a large land army, and we could face a war with them. We do not want to have a war with China. We don't want to have a war with China. It would be a catastrophe from both countries and for the world. We don't need World War III. Nuclear or not, forget the nuclear part of it, okay? We do not want a conventional war with China. The loss of human population, whether it's in the military or not, would be enormous. So they're the people who say, well, we just look the other way, okay? We just want to respect their system. Well, I don't respect their system if they're cheating on the rules, and they're using the rules, I think, to their own advantage against us. And I have a problem with that. As many, increasingly, by the way, the Chinese think, well, if Trump were in office, this would go away. Nonsense. The Democrats are saying the same thing now. It's not a partisan question anymore.
And I saw Biden say that as well the other day.
Yes, the pharmaceutical issue, I mean, I'm a free trader. Pharmaceutical issue, I didn't realize this before we started studying this. By the way, we brought this issue up in our white paper in 2018. This is not something we wrote an article that was circular around the world, but our white paper that's been on our website for 2 years now, we said this was a problem 2 years ago. No one listened to it. Now they're listening to it. There have been congressional hearings on this and all that. So those issues we need to confront the Chinese on. But what we don't need is to push them so far that we have a conflict with them. I mean a military conflict, which is what these things sometimes descend into.
You have a different opinion on that, or are you pretty on the same page?
Same. If I would add just maybe one more category, and I'll speak kind of like from my public health colleagues in that world. And we like to collaborate. We like to trust people. And there's been a lot of say Chinese scientists that have trained in the United States, and so there's a lot of I guess friendly relationships and colleagues in the public health and science community between the U.S. and China. So there's another factor, and that's naivete. That although that we are colleagues on kind of that professional level, too many don't realize that they may have there's only so far they can collaborate, and that they may be using that friendship and collaboration to a bigger strategic advantage. So there's naivete is another component of that.
I can totally see that. I have two more questions for you before we wrap up. Virus, coins, money, phone, where it lives. You've heard a lot of different data, 12 hours. 18 hours, clothes, dogs, pets, sex. What can you tell us about the lifespan of this virus?
We're not going to talk about all of that.
Well, I mean, you can take any part you want. You got kids, so you know about sex. So what can you tell us about any of this stuff on how a person could get, coronavirus?
Well, I think the primary mode of transmission of coronavirus is going to be person to person. It's going to be droplet. So when we cough or sneeze, and it's the droplets that come out of our mouth, and fortunately those droplets are falling to the ground, and that's why this social separation is recommended of 6 feet. So that's really the primary means of transmission. Now there are, we're beginning to understand what is the environmental half-life of the virus, if it's on a table, on a doorknob, and so forth. So some of those reports are coming out, and it may be in days as opposed to minutes. There's going to be much more. So that's part of that category of some of the sciences we don't unknown. But we're beginning to fill in the gaps and fill in the holes. But it's really that droplet transmission from person to person is really the primary means of transmission for a healthcare worker in the hospital. Particularly, they may be doing some type of procedure, caring for a patient that it could create an aerosol in the room, which behaves more, it may spread more than a droplet, but that's really kind of a special, unique situation in the healthcare kind of delivery in the hospital situation. So that's why these simple, tried and true infection control measures at the personal level are so important. Wash your hands with soap and water, and for 20 seconds, sing the happy birthday song. That's about 20 seconds. As a reminder, and if you're sick, stay home. If you need to seek medical care, by all means do, but call ahead so you know what the procedures are, where you should go, so that you're not. They will give you instructions of how to come in, and cough etiquette. That's all extremely important. So really, it's how do you avoid exposure? How do you avoid exposing others? Kind of think in those simple terms, but it's absolutely essential to make sure we take those simple things.
So droplets 6 feet. I mean, these are some good droplets if it can go 6 feet. By the way, I mean, legit.
They're tiny.
I'm giving you.
But that's what that's what we should do to try to minimize that exposure.
I wash my hands before I eat, long before the virus. I get sick very few times. Because the principal mechanism, other than droplets, is dirty hands.
I have come to a conclusion that you want to make sure the folks below 50 stop working. I've come to that conclusion. That's what you want to do.
My kids are below 50. I don't want them to.
You want us to stop working. So okay, last question, and this is my biggest concern. I'm not concerned about coronavirus, and what I mean by I'm not concerned, don't get me wrong. I don't mean. I'm being irresponsible and I got a wife and 3 kids and we're not taking the right measures. No, I was in LA, we had a board meeting. I got the news. I told my wife we're going back to LA. It was spring break for the kids. We were trying to take them to Universal Studios. My board meeting got canceled. We came back the same day. We're supposed to stay 3-4 days. We're doing the stuff at the company. Everything we're being responsible, what we need to do as a company. Okay, let's set that part aside. I'm not worried about coronavirus because I went and looked at the numbers of how infectious it is. The R0 number, whatever that number is that they look at, that shows like, say it again, R naught. Yeah, the number that you're looking at on how infectious it is and how measles was like 12 to 16. And then
it's 1 to 14, 16 for measles.
Yeah.
It's 1 to 2 to 3 for coronavirus. It's twice as infectious as the flu is.
It is. But here's the part. That's not even my question. Forget about coronavirus. Right. My concern is not coronavirus because, yes, these are still bad numbers. 1% estimate die and, 1.9 to 2.8, whatever the number, 1 to 1.9 or 1 to 2.8. That's the numbers I got that I'm looking at from CDC. Yes. Okay, I'm not worried about this. What are we going to do? Because Ebola was 50% death rate. MERS was 34.4, smallpox 30%, SARS 9.6. What are we going to do in the future? 10 years, 20 years, 30 years. You're in the world. 20, 30 years from now, when
white papers are all about this.
If, and I want to get the answers. We're going to put your white papers below. What are we going to do in the future where we get a virus that is both as infectious as measles and both as deadly as Ebola, right? What are we going to do there to be able to prevent that from all of a sudden half the population in the world dying?
Well, first, let me just take, why some viruses spread around the world and some do not. At the end of the day, a virus needs to have a living host. And so Ebola, on the bad news is it's over 50% lethality. But also those who catch Ebola, they have it. And that's why containment measures with Ebola are so effective or can be effective. It doesn't get out of control. So you can actually control Ebola. We might have another crisis like we had in West Africa or what's happening right now in the DRC, but it did not spread around the world. Could it spread further in the world? Sure, because of our globalization. But each virus is different. And some of these really high lethality viruses, they need a living host. And that's why containment type measures are extremely important, so we can stop it so it doesn't keep finding a living host. Now that's why COVID is concerning. Is it has a case fatality rate that's a lot lower, actually. But say it's 1%. But if it spreads around the world and infects just in the United States, some of the numbers you were using earlier, 60, 70, 90, however many, if it's in that range, well, that 1% fatality rate actually is pretty concerning, and so that number's kind of high. But what we have to do, this is really, let me get to what we need to be doing. First, we need to be taking emerging infectious diseases much more seriously than we have in the past.
I agree.
That really is the issue. And these are actually, they become not just in the domain of public health. These are really national security issues, health security issues. And so we actually have some of the tools at hand that can actually begin, if we focus our efforts, to begin to think about prevention in the first place. It's going to require some investment, but we've got to start taking emerging infectious diseases much more seriously than we do today. And maybe COVID-19 is a wake-up call, but guess what? SARS was supposed to be a wake-up call. 2009 pandemic, that was supposed to be a wake-up call. Ebola in West Africa in 2014, 2016, that was supposed to be a wake-up call. I just hope we can not push the snooze button after this is over.
Well, what do we do is what I'm asking.
This is
what I'll tell you one
That's
thing
what
we
I
can
want.
do that I can tell you from personal experience. The role of aid agencies like USAID and our NGO community and our contractors, health contractors, is to build the capacity of developing countries to deal with their own problems so that they can control these infections before they get out of hand. The trends now are that 75% of the 40 new diseases that have come up, infected people, human beings, in the last 50 years are from animals. Wild animals and domesticated, mostly wild animals, but domestic animals. Now, the institutions don't exist in many of these countries to prevent this from happening. They can prevent it, they can reduce it. Those wet markets in China, where they sell living animals, have been a problem for decades. The Chinese government would not do anything. They have now banned them. They should have banned them a long time ago. And they know that, but they didn't want to do it because it's very unpopular politically. There's a study that was done of the HIV/AIDS program that President Bush started and that President Obama continued. This is not a partisan question. And on the malaria program by Senator Daschle, who was a Democratic senator. He was the Democratic majority leader in the Senate.
Majority.
And was it Bill Frist?
Bill Frist.
Bill Frist is a Republican leader in the Senate. So the Republican and Democrat, former senators, they run this bipartisan center on policy, and they looked at why Ebola didn't spread in Africa. Why was it contained in only 3 countries? And it's because the HIV/AIDS program and the malaria program built the capacity of the Nigerian Center for Disease Control. There's no big outbreak in Nigeria. It's a huge country. It's a quarter of Africa is Nigeria. Why didn't it get loose? It's right next door. It's because the Nigerian Center for Disease Control that was trained by USAID and the our Center for Disease Control, CDC, together they helped build this institute, and the Nigerians built it. It was very effective in preventing the virus from spreading into Nigeria. So one thing that's not very popular, a lot of people, is to have aid programs that build institutions in other countries to deal with this, because the only way to deal with these outbreaks is right in the country itself. That's what we should be
most
doing.
of these dangerous viruses are emerging in low middle income countries where we lack, they lack the public health institutional capacities, and so that's where foreign aid can be very critical, because if we can first detect an outbreak there, and if we give them the tools to be able to respond, they can stop the outbreak before it becomes a regional epidemic or a pandemic. And so that's why these international investments
That's one thing
are
we
very
can
critical.
do.
Yeah.
we need to fix the federal government. I mean, I don't mean the whole government, I mean with respect to PAN. There's a whole bunch of questions that have not been resolved about who is responsible for what and how you turn the switch on when you turn the emergency response system on. Now, we're not going to go into it here, but Jerry is a member of the, what's the name of it?
Bipartisan Commission for Biodefense.
Yes, and he asked me to testify before it, I did, and he's very, I mean, you should read their report. It's a very powerful report on what needs to be done. So there are issues that have not been settled because senior policymakers in both parties have not seen until now this to be an issue. SARS may have been a wake-up call, Jerry, but people saw it in the newspaper. It didn't affect them personally.
That's right.
This is this is history changing. This is history changing.
This is not something to take lightly. You know when you grow up, you fear nuclear war.
Yes.
Oh my gosh, nuclear war. And then the last 15 years, you're hearing everybody saying, it's not going to be nuclear. It's going to be cyber war. That's what it's going to be. Well, I mean, the easiest way to manipulate any kind of war and try to hurt a country is through a biowarfare, which, you guys study. So to me, when I sit and look at the numbers, I'm a data guy, I'm a math guy, I'm a guy that studies exponential growth. We started a business from 66 agents to 14,000 agents in 49 states because the whole idea was about how can we exponentially grow. So it's the only thing I paid attention to in high school and college was math. Only thing. Everything else I could care less about, right? So when I look at data, I look at it from a different perspective. That concerns me. Here's one thing you said. You said you're able to control in the country. So this happens in Hubei, Wuhan, which is part of Hubei. 50 to 60 million people live in that area, whatever the numbers. You've heard 50, you've heard 60. And then it goes to Thailand, first country I think that has the case. And then it goes, Thailand then somehow comes to US because a guy was traveling to Washington who was just in China. 30-year-old guy gets it, first case. And then all of a sudden 150, 160, how many countries we're at right now? I don't know the exact, I think it's 160 plus where we are right now. And is not as infectious as some of these other ones, right? So my challenge becomes, if you have a daughter and she's 18 years old, she's dating a boy who has AIDS, not because he got it from sex, but because maybe his mother had it and the blood, something.
Yes,
what I'm trying to tell you is, would you let your daughter date this guy and wouldn't you have certain fears? So if we know China has a wet market, why is US okay with the travel? They're not creating more travel restrictions. Why does a country like US, who has the authority to tell China, listen, if you don't clean house with the way you have these kinds of things, I'm sorry, we're just not doing business with you. We're not going to let your people travel to us. So to me, the concern of me long term as a parent and as a person that runs a business goes to travel. If this has to be addressed through travel, if it's not addressed through travel, and it's too easy of doing that with every country, eventually, if somebody has the virus, it's going to come to you, and you never know where it's coming from. Right. So I don't know the answer to it. That's why I asked you thinking what you would say.
I think this crisis is going to cause a review, a rethinking of supply chains, a profound rethinking of supply chains.
I hope so.
Yes.
Not just the pharmaceutical industry, because now Apple realizes they've got 5 countries or 7 countries producing the components of an iPhone that's produced in China. If one of those sequential parts of the supply chain shut down, they can't produce the iPhone. They've created a system that's highly efficient, keeps the price down.
That's America's fault.
I know.
That's America's fault. I'm sorry. That's
You're
America's
right.
fault.
You're right.
Because 2 reasons. The consumer wants to pay cheaper and the entrepreneur wants to sell it make bigger profits.
Correct.
Guess what? This product's going to be 20% more, but guess what? It's made in America, period. It's made in U.S. You don't want it, don't buy it.
Right.
If you want to go buy a cheaper product that's made in U.S., but it's not as good of a product, you don't have to buy this thing. But I do think you're seeing more and more bragging rights about companies saying made in U.S. I think that's going to go even to a whole different level. When I'm seeing a company say made in U.S., I want to buy the product and support it.
Let me mention one last thing we could do. We could set up, CDC was trying to do it, AID was trying to do it. The funding has been cut off from it. No one took it too seriously. AID was identifying the 2,000 viruses that are the ones that, because there are like 150,000 viruses they've identified. I don't know the exact number, but it's an enormous number. But most of them are not a threat. They've identified through a project that AID ran with funding from the Congress that came out of, I think the Ebola, it was out of the Ebola supplemental budget. And it created a system for identifying those viruses and then setting up a sentinel surveillance system around the world to give us early warning. We have an early warning system for famines that we started in 1985. There's been a substantial drop for the first time in in fact, in history, the first time in history there's been a massive drop in famine deaths is because we have an early warning system to tell us when this is about to happen. We need an early warning system around the world when these virus outbreaks take place and to give us the time. You know what the biggest problem is in the response is time. 3 weeks in an emergency response in a fast onset disaster like this is a huge amount of time. If you made decisions, the first week that this happens,
I agree.
you can stop it.
I totally agree.
Yes, but you need a surveillance system.
Yeah, but you can't do it if it's in another country that's not doing it at the levels that you're doing it at. That's what I'm saying.
You can set up
you're
a
not
system.
in charge of that.
You can set up a system.
You may be able to set up a system, but if they don't want to follow the rules you're
No,
following because
I
it's a
know.
totalitarian,
No.
what are you going to tell them how to do?
I understand that. But there is a way of checking what's going on in other countries without actually being yourself in terms of Americans in those countries.
So we have to do more to get earlier warning. We have to do more internationally to build capacity and try to prevent an outbreak anywhere it starts from becoming an epidemic. But we also have to do more in our own country. So whenever we do have a major outbreak like a pandemic, that we can respond better in the United States. And we have to have incentives that the private sector is more part of the solution. We can't be totally dependent upon, say, the CDC for laboratory testing, as an example. And so we need to we need to have systems in place that the private sector's part of the preparedness activity from the start. We can't just turn it on like a switch when there's a crisis.
Find a way to make it profitable to them.
Absolutely,
And,
absolutely.
Go make money on it. I don't care what it is.
That's hard, but we've been talking about it a long time, but we got to figure that out.
You find a way to give them that credit. By the way, does 5G have anything to do with this or not at all? Have you seen any reports with 5G in this or not at all?
I have not.
Nothing? Okay, one of the conspiracies is 5G, by the way. I don't know if you've seen that or not.
There's a conspiracy that
about 5G. Go look it up.
That it's related to this?
Oh, yeah. They're saying that 5G with the waves is helping this thing spread. I don't know if you followed any of this stuff with 5G. 5G's threat on, well, that's a whole different topic. I don't want to go to it. All I can say is this. I really enjoyed this conversation. I want to say it's a couple hours. To me, it feels like 5 minutes. Thank you so much for your help and coming out and giving us all the insight and being willing to take some of the questions and pushback, because that's how we all learn. And hopefully if this thing, if we have more questions and this is formulating a little bit more in the audience wants you guys back, hopefully we can invite you guys back in the future as well.
Thank you very much.
Thanks so much for coming out. I'd shake your hands, but you know why we can't, because of the time. Yes. Thanks, guys.
Thank you.
By the way, if you watch this interview and you want some of those papers that we're talking about, please click on the link below. We're going to leave it for you. And on top of it, I got 2 other videos I want you to watch. One of them is an interview I did with General Spalding, General of Air Force, who went and lived in China as part of his project and his duty, and he came back and he gave a talk one time that got him in trouble, and he ended up getting fired. It's a very, very powerful video. He talks about 5G and a bunch of different things that China's doing. And then the other video is a video I did on coronavirus that talks about how coronavirus shut down the world. And it's very, very deep. If you haven't watched this one, click on this one. If you want to watch General Spalding, do that. And if you haven't subscribed to the channel, please do so. Thanks for watching, everybody. Take care. Bye-bye.